when Together asked me to address you about the crisis in social care and why it is so important that we do something about it, I thought, where do I begin? The sector is huge and the problems within it deeply rooted. So I'm going to sketch a brief picture. Like most of our public services right now, social care is utterly broken. I'd go further than that, and I'd say that the social care sector is seriously at risk of imploding. For those currently struggling to source adequate care for themselves or their families, those suffering abuse and neglect in understaffed, under-resourced care facilities, or families embroiled in lengthy and vexatious battles with social services over the right to care for their own children, those words will ring true. As they will to the 500,000 currently awaiting a care assessment, the families of the 1,400 who died last year waiting for one, or the estimated 9 million unpaid carers now propping up a broken system, many of whom have had to give up work in order to do so. The care sector is buckling under the strain of the record levels of demand that are being placed upon it, wholly incapable of meeting the needs of our elderly and disabled citizens. Due to the dire lack of capacity in the system, care support is being rationed, with needs deliberately underestimated or downgraded to justify what are often wholly inadequate packages of care. Those living in care homes are also being failed. As providers struggle to fill vacancies, residents suffer the consequences. Already inadequate before the pandemic, staff-resident ratios have plummeted, negatively impacting care quality and increasing risk of serious harm, as the tragic and increasingly frequent reports published in our local and national press attest. Our community health services are also struggling to meet demand, again with sometimes tragic consequences. Due to the difficulties in accessing appointments and timely treatment, thousands of elderly and vulnerable citizens are ending up in hospital. Once treated, they languish in hospital beds, awaiting care home placements or home care packages to enable them to leave. Many rapidly deteriorate, so by the time care support is finally sourced, their needs have significantly increased. Reports to Together Social Care also confirm that hospitals, in their eagerness to free up beds, are discharging patients prematurely, causing them to end up back in hospital days, sometimes hours later. So how did we get here, and what can be done? While it's true to say that the current crisis has been decades in the making, there is no doubt that the monumentally misjudged policy decisions taken during the COVID-19 pandemic have brought an already crumbling system to its knees. Draconian care home visiting restrictions, Hancock's disastrous hospital discharge policy, and vaccine mandates have had a devastating impact on staff morale, recruitment, and retention. Is it any wonder that the sector has 152,000 unfilled vacancies? That the 40,000 staff who left during the pandemic have not come back? While an apology and compensation following the lifting of the mandate may have helped encourage them to return, why would they when they can earn far more for far less arduous work in retail and hospitality? I paint a grim picture, but it doesn't have to be this way. There is a solution, and that solution is us, the public. Together has already demonstrated what can be achieved when we join together in solidarity and shared purpose to seek solutions to the problems impacting us. From our interventions during the pandemic, when we came together in our thousands against lockdown restrictions, vaccine passports, and the vaccine mandate, to our most recent interventions, we have shown our political class that we are a force to be reckoned with. Together is about defending the public interest, pushing back against unpopular policy impositions, and helping mobilize the public into action to achieve shared aims. And nowhere is this more needed than in the realm of health and social care. How do we begin to build a social care system fit for purpose? Together has some ideas, but we don't have all the answers. By coming together to discuss the multiple crises facing our public services, by asking the difficult questions our political class prefers to avoid, and by putting our heads together to explore solutions, we can begin to offer an alternative vision for social care. It will take years to even begin to address some of the problems, but we need to start somewhere. And the Together Social Care Workgroup has already set to work. We now have a strong team of members, each from different fields of experience, some of whom already run their own campaigns or charities. We also work with various individuals and groups nationally and are busy expanding our network of campaign partners. We are in the process of expanding the team and plan to extend our campaigning activities in the near future. We are particularly mindful of the power shift accelerated by the pandemic away from individuals and their families to the state, and plan to challenge increasing state overreach within adult and children's services. Regardless of whether the crisis in social care impacts us personally, we have a civic duty and a responsibility to ensure that those requiring care receive adequate support, that they have a direct say in how care services are organised, delivered, peopled and regulated, and to resist further attacks on their liberties and freedoms. We hope you will join us. Thank you.